Hi, my name is Carmen Coleman. I am the president of Lifetime Financial Group. And what we do is we specialize in insurance products and financial products, and we also specialize in notary services. Today we're going to talk to you about the Affordable Care Act. And we're going to begin by talking about the legislation of the Act. The Affordable Care Act was signed by President Obama into legislation in March of 2010. The health care law aims to increase access to health care coverage and to introduce new protections for people who already have health insurance. The Affordable Care Act also will enable an additional 1.1 million people in the state of New York alone to have health care coverage and more overall. The Affordable Care Act will increase access to coverage in the following ways. It will establish the health care insurance marketplace so that individuals can obtain health insurance coverage, including standalone dental coverage, and it also will help small businesses to purchase insurance through the Small Business Exchange. It'll provide for premium tax credits and cost sharing reductions to help eligible low-income and middle-income individuals purchase health insurance through the marketplaces. It'll provide a small business health care tax credit to eligible employers. The exchange will also provide new opportunities to state Medicaid programs to cover additional adults and children with low incomes, and it will simplify the eligibility rules for Medicaid and Child Health Plus. Just so you know, the Congressional Budget Office estimated that 9 million uninsured eligible individuals could obtain coverage throughout the marketplace in 2014, rising to an estimated 25 million by 2022 in the United States. So what is the healthcare marketplace? It's a commercial insurance marketplace where qualified employers and qualified individuals can shop for private insurance plans. The enrollment begins on October 1st, 2013, and your coverage will begin on January 1st, 2014. All consumers will have more choice and selection in health plans, and consumers will have access to insurance affordability programs if they're eligible. Here are the state marketplace options. Each state can choose to create and run its own marketplace exchange. They can either partner with the federal government to run some marketplace functions or have the federal government marketplace operate as their exchange. There was a federal grant awarded to states for activities related to establishing their own exchange and marketplaces, and those awards will still be available through December 31st of 2014. New York State has decided to have their own exchange through Governor Cuomo by issuing Executive Order Number 42 in April of 2012, which effectively established the New York State Health Benefit Exchange. Here are some elements of the Affordable Care Act that I'd like to review with you. The Act prohibits health coverage denials due to pre-existing conditions. It also covers all your dependent children up to 26 years of age. It eliminates lifetime limits on coverage. It expands the Medicaid for individual options. It establishes the state-based health care exchanges. It creates tax credits for participating small businesses, and its formation of the small federal subsidies and penalties for eligible individuals. The health care coverage options for individuals in 2014 will lower the monthly premium amounts an individual pays throughout the year. It's available to eligible individuals with household incomes between 100 and 400% of the federal poverty level. This is a New York State number. Each state had the ability to choose their federal poverty levels. In New York State, choose 100 to 400%, which is $45,960 for an individual and $94,200 for a family of four in 2013. And individuals who do not have access to health insurance coverage that qualifies as minimal essential coverage. Now, based on your household income and family size for the taxable year 2013, your subsidies will be selected through the exchange. Coverage is paid each month by the federal government to the insurer. It's reconciled on the taxpayer's tax return after the end of the year of the coverage year. Now, what about financial assistance and availability in the marketplace? There will be an advanced premium tax credit in the marketplace available that will lower your monthly premium amount an individual pays throughout the year. It's available to individuals in household incomes between 100 and 400% of the federal poverty level, as we discussed, in the state of New York, and also those who don't qualify for health insurance coverage that has minimal essential coverage. Now, based on your household income and family size for the taxable year, this credit will be calculated. It's paid each month by the federal government to the insurer, and it's reconciled on taxpayers' returns at the end of the year of coverage. There's cost-sharing reductions as well. It'll reduce your out-of-pocket expenses such as deductibles, co-payments, and co-insurance. It's generally use federal guidelines available to enroll in the silver level plans with income between 100 and 250% on the federal level, which differs from New York State in 2013. It's based on your household income and family size for the taxable year, and it's also available to American Indians and Alaskan Natives. Now, there are small business options as well in the legislation. Small businesses can buy insurance through the New York State Health Benefits Exchange, which is called the Small Business Options Program, or SHOP. Small businesses can buy directly from an insurance company if they choose, or they can self-insure. You want to check with a health benefits consultant before making any choices, just to be sure that you correctly qualify for these plans. The advantages of purchasing through the exchange: you can make health plan choices through the exchange. You can do a defined contribution towards your employees' premiums. The administrative simplicity of the exchange means that it's one payment made through the exchange, and then there's also tax credits available to small businesses who purchase through the exchange. Health plans will be standardized in 4 coverage tiers based on a percentage of the total allowed cost of benefits paid by a health plan on average. If you have a bronze level, and by the way, there are 4 levels: bronze, silver, gold, and platinum. A bronze level will pay and cover 60% of your costs. The silver level will cover 70% of your costs. The gold level will cover 80% of your costs, and the platinum level will cover 90% of your costs. All health plans offered through the marketplace must include 10 required essential health benefits. And I'll review these very quickly. They're the ambulatory patient services must be covered, emergency service, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management. Pediatric services, including oral and vision, are also covered. Health plans must also comply with the new marketplace reforms as applicable. There's shared responsibility. Employees must have health insurance if affordable or pay a penalty. Small business employers are not required to offer health coverage or pay coverage for their employees. The penalties will increase each year beginning in 2014 for an individual who is not enrolled in health insurance. In 2014, the penalty will be $95 per adult, or it's $47.50 per child, up to a maximum for a family of $285, or 1% of the family income, whichever is greater. They will increase in 2015 to pay $325 per adult or pay $162.50 per child up to $975 for a family maximum or 2% of your family income, whichever is greater. In 2016, the penalty will be $695 for adults or pay $347.50 per child up to $2,085 for a family or 2.5% of family income, whichever is greater. If you have a health plan that you are currently in, you are allowed to stay in your health plan, as there will be grandfathered health plans. The Affordable Care Act allows individuals who are currently enrolled in a health plan to stay enrolled in their plan if they want to. Health plans lose grandfather status when they significantly cut benefits or increase out-of-pocket spending for consumers. The medical loss ratio will issue rebates to enrollees if this percentage does not meet minimum standards. Between 80 and 82% of premiums must be spent on medical claims and quality improvement, with 20% of those premiums to be spent on administrative costs and agent commissions. Market reforms consist of collectively ensuring that individuals and employers will have a minimum set of protections with respect to access to health insurance coverage and greater premium stability in all states, both inside and outside the marketplace. Market reforms. Fair health insurance premiums, health status, and gender are not used to set premiums. And there's limits on age rating. There's a single risk pool. Issuers cannot use separate risk pools to charge certain customers higher rates. There's a guaranteed availability coverage that must be offered to all consumers with limited exceptions. There's also a guaranteed renewability coverage that must be renewed for all policyholders with limited exceptions. The covered markets and effective dates. Reforms apply to non-grandfathered health coverage starting in policy years for the individual or plan years for the group beginning on or after January the 1st, 2014. Both individual and group plans will have the following: group fair health insurance premiums, the single risk pool, the guaranteed availability, and the guaranteed renewability. Large employers are not required to have the group fair health insurance premiums unless the state allows issuers to sell large group coverage in marketplaces in 2017. In New York State in 2017, large businesses will be permitted to enter the exchange. The large business is not required to do the single risk pool either, but they are required to have guaranteed availability and guaranteed renewability in their plans. The market reforms do not apply to grandfathered plans and self-funded plans, accepted benefits, or individual short-term limited duration coverage. Fair health insurance premiums. The only factors that may be used to vary the premium rate for a plan in the individual or the small group markets are age, family, tobacco use, and geography, living in the service area of the plan. Health plans cannot charge premium rates based on health status, claims experience, gender, insurance classification, or small group size. Let's talk a little bit about the age rating. The plan premium rates can vary within the ratio of 3:1 for adults 21 and older. Rates also can vary for children under 21 based on actuarial justification. States can establish age curves or can default to the federal age curve. Age bands between the ages of 0 and 20, 1 year bands between 21 to 63, and 64 and older bands. So there's 3 bands, 0 to 20, 1 year bands between 21 and 63, and 64 and older. The tobacco rating premiums can vary within 1.5 to 1 ratio. They can vary based on age. Example, 1.2 to 1 for those under age 35 can be a rating. Small group plans may only impose a tobacco surcharge in connection with a wellness program that complies with Section 2705J of the PHS Act, and that allows participating individuals to avoid the full amount of the surcharge. Tobacco use defined in terms of regular use and time of last use. For an example, if you smoke 4+ cigarettes per week within the last 6 months, could be an example of an average that could be monitored. Geography. States are permitted to establish rating areas based on metropolitan statistical areas, or MSAs, and non-MSAs, 3-digit zip codes or counties. These areas were established on January 1st of 2013, or no more rating areas than the number of MSAs plus one in the state. If a state did not establish rating areas, they will default in one rating area for each MSA and one rating for all non-MSA areas in the state. Those are the metropolitan statistical areas. When family size is considered, the total premium for family coverage generally must be determined by summing the premiums for each individual family member. For family members under 21, total premium includes only the premiums for no more than the 3 oldest covered children. Tobacco and age rating must apply only to the proportion of the premium attributable to applicable covered family members. If a state prohibits age and tobacco rating, the state may require using uniform family tiers and the corresponding multipliers. The ratings in the small group market will be rated as follows. The total premium charged to the group is determined by summing the premiums of covered participants and beneficiaries. The same requirements regarding per member ratings and family tiers with corresponding multipliers will apply. If a state does not permit rating based on age or tobacco use, that state can require the use of family tiers instead of the per member ratings. Now, the ratings in the small group marketplaces, the states may require issuers to base premiums on average composite enrollee amounts. The total group premiums must be the same total amount that would result from calculating on a per member basis. Employers can decide how to allocate contributions to their health coverage. So when can you enroll? If you're an individual, the first open enrollment will begin October 1st, 2013, and it will end March 31st, 2014. If you enroll between October 1st, 2013 and December the 15th of 2013, your coverage will begin on January the 1st, 2014. The annual open enrollment after the first year will be October 15th through December the 7th of each year. Your coverage will begin on January the 1st of the next year. I want to also point out that if you are a consumer eligible for Medicaid and the Child Health Plus program, you can enroll at any time. There also will be special enrollment periods. There are certain events that may allow individual consumers to enroll during a special enrollment period, including the loss of minimum essential coverage. If you get married or have birth or placement for adoption, you will qualify for special enrollment. If you gain citizenship or qualified immigration status, enrollment errors by the Health and Human Services or the Marketplace will also qualify you for special enrollment. If your qualified health plan violates its contract in the materials provision, you will qualify. A change in eligibility for tax credits or cost share reductions will qualify you for a special enrollment. If you gain access to new plans as a result of a move, or Indians may enroll or change qualified health plans one time per month. If you have exceptional circumstances or enrolled in a non-qualified employer coverage, you will qualify for a special enrollment period. There will be assistance available in the different types of marketplaces. There will be navigators, there will be in-person assistant personnel, and there also will be application counselors that will be trained to assist you. In the state of New York, each county of the state were issued 2 assigned navigators If, for instance, you are in Monroe County, New York, you can access a navigator at the Anthony Jordan Health Center and the Unity Health Center for assistance. How will the marketplace impact small businesses? Let's talk about that. Starting in 2014, a shop will be available in each state. Starting October 1st, plans will be available for review and enrollment for coverage starting as soon as January 1st, 2014. There will be rolling monthly enrollments for employers after January 1st, 2014. Once a group is enrolled, its rate is guaranteed for 12 months. Here are the eligibility rules for employers. To participate in the SHOP, the Small Health Options Plans, employers must have 50 or fewer employees, be a valid business, offer qualified health plan options to all future employees, and have a business address or primary employee website in the state of New York. How will the marketplace impact small businesses? To enroll, the employer must have a principal place of business or an employee worksite in a shop service area. They must have at least one eligible employee. In most cases, spouses and children cannot be counted as an eligible employee. If you are a sole proprietor without any eligible employees, you may enroll through the individual marketplace. To enroll, the employers must have fewer than 50 full-time equivalent employees. The states may elect to increase the limit to 100 for 2014 and 2015, so you want to check with your state to see what the requirements are. If you are a federal exchange, you will use the full-time equivalent counting methodology when establishing your group size to determine employer eligibility. State-based marketplaces will be able to set their own counting methodology in 2014 and 2015. States with their own marketplaces have more flexibility to offer shop coverage to all full-time employees who work 30 plus hours per week. The employer choices are two. You can participate in the shop exchange. Employers are not required to offer all the plans in the exchange to their employees. So employers can look at all the plans and choose those plans that you would like to offer to your employee group. Employers are also not required to contribute to employee premiums if you use the small business exchange. The employer's registration and enrollment will require you to submit information to the exchange. Employers will be required to provide data on the number of full-time employees, the number of part-time employees, the full-time equivalents, the average annual wage data, the employee roster data, including the name, the email address, the home address, the date of birth, social security number, and the hire date of the employee. The small business tax credit for eligible employers will effectively lower the cost of an eligible employer's contribution to the premium cost of employee health coverage. It has been available since 2010 for eligible employers, including nonprofits. Up to 35% tax credit on employer contributions, which will increase to 50% in 2014. Eligible employers who employ fewer than 25 full-time equivalent employees will be eligible for a tax credit. They must contribute at least 50% or more towards the premium cost of the employee's coverage. The average annual employee wage must be less than $50,000 a year. Beginning in 2014, a business must participate in the shop to receive the tax credit. There are nearly 360,000 businesses who's benefited from the tax credit in tax year 2011. I want to make a note that the premium tax credits and cost sharing reductions for individuals who are eligible to receive coverage from their employers through the shop. Calculating the small business tax credit will consist of looking at your full-time equivalents for your firm size. So what is the full-time equivalent? the total full-time employees plus the total annual part-time hours divided by 2,080. Owners are excluded from the full-time equivalent count, and employers cannot receive tax credits for the owner's insurance either. All employee hours are counted and based on a 40-hour work week. Wages will equal the total wages paid divided by the full-time equivalent number. Owners and family members' wages are excluded from total wages, and seasonal workers are excluded as well if they work less than 120 days. How do you determine the small business tax credit? The maximum small business tax credit is up to 50% of a taxable small business premium cost in 2014. If you are an exempt business, your cost premium reduction can be up to 35%, and your premium costs, refundable via payroll tax. Your credit is reduced on a sliding scale. As average wages increases from beyond the $25,000 up to $50,000, or as your full-time equivalent number increases from 10 up to 25. There are two calculators that are available to help you calculate your tax credit. The national tax calculators can be found at two websites, so I'll give you www.smallbusinessmajority.org/tax-credit-calculator, or the second site is www.nfib.com/advocacy/healthcare/credit-calculator. For further updates, you can visit our website at lifetimefinancialnews.com, or you can visit our Facebook page at facebook.com/lifetime-financial-news, or you can visit the New York State Exchange for information on how the exchange works, and it is up and operating now. Go to www.healthbenefitexchange.newyork.gov. And there's also a federal exchange that you can go to if your state is a federal state who will not participate in the exchange or is a hybrid state. If you're an individual and you're concerned about your tax credit, this is how it will be determined. Individuals will receive a tax credit and/or subsidy if their health insurance cost is greater than 9.5% of their W-2 Box 1 income. The exchange will be available to provide data analysis in real time to determine tax credit and/or subsidy amount. The Department of Health and Human Services will coordinate with the IRS to process all applications. Thank you so much for attending this presentation. Again, my name is Carmen Coleman, and I'm the president of Lifetime Financial Group. You can reach me at area code 585-325-2525 or email lifetimefinancial@frontier.com. And again, our website is lifetimefinancialnews.com. Have a great day.